Fasting for inflammatory bowel disease, right? Does it help? If you are suffering from any of IBD, like ulcerative colitis or any other IBD kind of disease, what we are talking about is, does fasting help? Is there a research or not? Is there a science behind it or not? So these are the topics, discussion points that we're going to have with naturopathic doctors. So hang on for 1 second. All right, so Dr. Jerrica is going to join me, and we are going to be talking about the research behind fasting. Hello, how are you?
I'm good. How are you?
I am great. Happy Friday.
You as well.
Well, we have a very interesting topic. You know, I was actually reading up a little bit of research, and there's quite a bit of research that talks about how fasting can help with IBD type of conditions. And you are a naturopathic doctor, so maybe just tell us a little bit about yourself, and then we can go into the topic.
Great. So thank you for having me on. My name is Jerrica Sweetnich. I am a naturopathic doctor. I'm also a certified nutrition specialist. I practice in Cleveland, Akron, Ohio. We're a functional medicine practice. We do a lot with hormones, but I'm very passionate about the ketogenic diet, fasting, and hormones. So that's kind of me in a nutshell.
Okay, well, great. So let's talk about how fasting can help with IBD.
Sure. So first of all, I think it's kind of important to define what IBD is. So IBD, what it is it's kind of an umbrella term. So it encompasses a number of different conditions that have to do with inflammation within the GI tract. So like you had mentioned earlier, one of them is Crohn's. Another one of the most common ones is ulcerative colitis.
Yes.
And so both of them, again, entail having that just chronic inflammation within the GI. And so when it comes to fasting, there's a number of different things that fasting can do to help. So most of the research right now in fasting and IBD is actually done in rodent models, but there's ongoing research right now on clinical human trials because of the rodent studies that we've seen. So fasting helps in a number of different ways. Number one, it can impact our gut microbiome. So our microbiome is this large collection of bacteria, viruses, yeast that live within our large intestine. There's about 4 trillion bacteria there. So it's I've heard this before, that there's actually more organisms in your microbiome than there are cells that make up our body. So some people say you're actually more bug than you are human. It's kind of crazy.
Yes.
But one of the things that fasting can do is it can help to alter the composition of that microbiome. And why that's important for IBD is that when the microbiome is off, that can set off inflammatory cascades. So if you're working on your microbiome, if you're working on getting all those good bacteria replenished and back in there, you can actually significantly reduce the inflammation that way. So that's one of the main ways. Another way is that there's this whole term called leaky gut going around. So what leaky gut is, right, is increased intestinal permeability. And that, you don't want that. You want your gut to be nice and tight, keeping everything within the GI separate from the rest of the body. Similar to the effect on the microbiome, if you have a leaky gut, you can have an increase in inflammation. You can have a number of different things go on. So fasting can actually help to repair what are called tight junctions, which help with the permeability and reduce the permeability within the GI tract. Those are what you can get from basic water fasting. You can get a little bit of that from intermittent fasting, And then there's another type of fasting called the fasting-mimicking diet. And that gives those two benefits, but on top of it, it also helps with a couple of other things. It helps with stem cell generation, specifically within the GI tract, which is incredible. You know, we're talking about stem cell therapy that's in the news, especially the past 10 years or so. And you can actually get stem cell generation from doing this fasting-mimicking diet. And again, why that's important is because in rodent models, there was an actual reversal of the pathology. So the damage to the tissues that occurs with IBD can actually be reversed by the stem cell generation with the fasting mimicking diet. So that's just mind blowing and incredible, because that's something that I don't think that there's any drug that can even touch or do that.
Absolutely. So I was just reading up, and I'm not a doctor here. The symptoms of IBD is like diarrhea, bleeding, down the skin, and these are chronic, right? For ulcerative colitis and Crohn's. So now the mimicking diet that you're talking about is very interesting. How does it work? Like, what exactly mimicking diet means?
Yes. So the fasting mimicking diet was developed by a researcher. His name is Dr. Walter Longo, and he has been in the aging field for decades. And what he found was that people that fast had an extended lifespan, but they also had an increase in the quality of life. But he saw that all these people were miserable. Nobody wants to fast.
Yeah.
You think about food, it's such a part of our society. Who wants to not eat? So he decided to come up with this program called the Fasting Mimicking Diet. And what it is it's essentially a 5-day diet that kind of tricks your body into thinking it's fasting, but you can still eat food. So he formulated specific amount of calories, specific amount of macronutrients, so proteins, fats, carbs, but he also put micronutrients in there. So your vitamins, your minerals, things like that. And he thinks that that's why there's the difference between water fasting and the fasting mimicking diet in terms of the benefits that you get with that reversal of the tissue pathology. He thinks that there's something to getting those nutrients in with a very little amount of calories still.
Okay. So it would be like, what kind of food would you eat, like with the mimicking diet versus the intermittent fasting that we were talking about? The intermittent fasting is like you eat within a certain number of hours and then you don't eat, right? Something like that, right?
Yes, exactly. So intermittent fasting, just like you said, it's eating within a certain time frame with about a 30% reduction. And that can give you some benefits to your microbiome, some benefits to that intestinal permeability. Water fasting would be to only to only drink water for a minimum of 24 hours. Some people do it 4 or 5 days long. And that's where you really get a lot more of those benefits for the microbiome, for the intestinal permeability. But the fasting mimicking diet, it's a program that you actually buy. And so there's crackers with it, there's soup, there's a couple of different olives, things like that. So again, it's all based upon his calculations that he came up with to get those certain amount of calories, certain amount of proteins, fats, carbs, whatever it is.
So you can only buy that from the researcher who's done the research, is what?
Right. Yes, exactly.
Oh, okay. That's interesting. So what else? What other type? I mean, there are a lot of other type of fasting, like 1 meal a day. And so when we were talking about the intermittent fasting, are there any rules? Like, there's so many different type of intermittent fasting, like 16-8, 24. I mean, so is there certain type of intermittent fasting that is recommended for IBD?
So that's a good question, and there's really not a lot of solid research on it. So the research that we're looking at, again, it's more the long-term water fasting. So I guess if you have IBD and you don't want to do a longer-term water fasting, you might want to do an intermittent fast that's like a 24 intermittent fast. So you're fasting for 20 hours a day, eating within a 4-hour time frame. Now, that is not great for everybody. Women's hormones can be affected by that. So I usually recommend definitely talking with a practitioner before you go about implementing any of these.
And then on just a higher level, I mean, this is not a medical advice, this is just an educational session. So the type of, like, especially someone has an IBD, it's inflammatory gut, right?
Right.
Certain type of foods that even if when you're going into the intermittent fasting, would you be restricted, or what kind of foods would you tell from a group point of view that they should eat during that time frame?
Sure. So I would say it's actually important to look at what you shouldn't be eating. So sugar. Yes. We all know, right? Sugar is the driver of inflammation. You definitely want to limit your sugar intake. Also, processed foods. Processed foods are kind of along the same lines with sugar, right? They're inflammatory. They create the inflammatory, or they set off the inflammatory cascade. They can mess with your microbiome, giving you more of those bad bacteria. So those are the two foods that I usually really recommend that, you know, IBD patients kind of hone in on and really try to cut out.
And then what should they eat? Like whole foods, plant-based diet?
Yes, yes. So what the research states right now is that fiber is really important for people with IBD. Certain types of IBD, not all of them. Sometimes you want to avoid the fiber. But olive oil, more along the lines of plant-based is what most of the research is stating right now.
Okay. So you're also a naturopathic doctor in addition to being a nutrition expert. And naturopathic doctors use a lot of herbs. So I had to ask this question, you know,
Sure.
and I love herbs. And what type of herbs would you recommend for specifically someone who has IBD?
Sure. So we're looking at those anti-inflammatory herbs, right? So probably the most common one that most people listening would know about, turmeric. Right?
Yes.
Turmeric is a wonderful anti-inflammatory. We've got those curcuminoids, which really have that powerful anti-inflammatory shift in them. You just have to be careful with the way that you take it, because turmeric is very poorly absorbed. So you want to take it with something that either has black pepper in it or a supplement that has been formulated specifically to increase and enhance the absorption of that turmeric.
It's not your tabletop turmeric like, you know, you find in grocery stores that, at least, you know, in a lot of Asian cookings, you use it. I mean, I use it curries and all. That's not really good, is what for the absorption point of view.
Right. It's not going to hurt by any means.
Yeah.
But, you know, when you have something as severe as IBD, you definitely want to look more towards the supplement route, because it can just be, it definitely is a lot more potent going that way.
Yeah. And so so we actually, we went around and we talked about the solution part of the IBD.
Yeah.
But what is the actual cause? What causes this IBD? I mean, why do we get all inflamed? Is it diet only, or is it something else?
That's a great question. So we actually don't really know. There's some people that think it might be genetic. We do know that there are certain risk factors. So being Caucasian will increase your risk for IBD. Cigarette smoking will increase your risk of Crohn's disease. So those are kind of the two most common things. Chronic use of NSAIDs, so ibuprofen, Advil, all of those things. And like you said, diet is kind of a controversial thing. There are some people that say absolutely diet can cause IBD, and then there's other researchers that say no, there's no correlation. So what I usually tell people is, hey, you know, eat well, right? Err on the side of caution and eat well. That you're going to just set your body up for the best.
Yeah. And then what kind of testing would you do, like GI map testing or any other testing? I know you work in the functional medicine doctor clinic, so testing is very important.
Sure. So to get diagnosis of IBD, sorry, I paused there. To get a diagnosis of IBD, you do have to do a colonoscopy. Sometimes they'll do MRIs or CTs to rule out other things. When I have a patient that comes in, though, with IBD, I do a ton of gut testing and stool testing, like you said. So GI map, like you were talking about, is one of them that looks at calprotectin, which is the gold standard marker of inflammation. It looks at your microbiome. What type of bugs do you have? Do you have the good bugs that we want? Do you have bad bugs? And then I also do SIBO testing often. So SIBO stands for small intestine bacterial overgrowth. And sometimes we see correlations with IBD and being positive for SIBO.
Oh, okay. So we have a question. Someone is asking, does alcohol factor in?
That's a great question. So yes, alcohol can definitely factor in. It can cause, again, the irritation of the lining of the GI tract. You know, one of the main symptoms of having IBD is having diarrhea. And unfortunately, if you have a lot of alcohol, that can only perpetuate that. So again, we usually recommend staying away from the alcohol.
Sure. So what would you recommend to the users? Like, they should seek out, I mean, this is a serious chronic condition, so they should seek out a practitioner rather than experimenting all these fasting by themselves. Yeah.
Absolutely. Absolutely. That's a great point. You know, and even with supplementation, I mean, you walk into the vitamin store and there's a million different things, and sometimes you can play the guessing game. So I always recommend seeking out a practitioner, getting the right testing done, and then that way you can have a tailored treatment plan that's personalized to you.
And is it reversible? No, I can, with with the help of diet and supplements and.
So you can definitely put it into remission. So people that have IBD, they do go through phases of remission where it's not active, they won't have any signs or symptoms, and then it can come back. So what we see in functional medicine is that we're able to keep our patients in remission for quite some time, if not, everlasting.
So, and what are the tools that you use? Of course, diet as being one of them. Exercise, does that make an impact on this? You see?
Yes, I would say definitely. It depends on where they're at in the disease state. You know, sometimes people tend to over-exercise, and that doesn't always help, so we might have to back them off. Sometimes people are very inactive, so that with that type of a patient, we will want to maybe do just a little bit more, nothing too stimulatory, especially if they're active. So exercise plays a role. Absolutely, diet. That's the most important thing by far. And then, certain supplements, certain medications when appropriate.
Okay. Well, this is all right. I see another question. Are turmeric supplements engineered for absorption? That's the question.
Yes. So it depends on the brand that you use. So some of them are. So when I was talking about the delivery system, what I meant is that they'll actually take the turmeric and they'll put it in a different type of delivery system that can actually enhance the absorption of it within the GI tract. So you want to look for something that has a delivery system like something called Vezisorb. That's one of them that's patented, that's able to enhance that absorption.
Oh, so it's like some kind of a brand that has that.
Right, exactly.
Okay. I hope that answers your question. Anyone else? I see a lot of people have joined. You're welcome to ask more questions, comments, feedback. I saw feedback. They liked the information. Thank you so much. Amazing information that you're giving all of us. Any other comments of people joining now? Well, we've been talking about how does fasting help with control of IBD, inflammatory bowel disease. That's what we've been talking about. Anything else you'd like to add before we wrap up today?
I think we covered quite a bit today.
Yeah, I know we were like on a rapid fire here.
We got to the good stuff. That was good.
It was excellent. Absolutely amazing, amazing session. A lot of good, amazing information to all the viewers. I know it's Friday night, but you can catch our session. We're going to make it live on our Insta page. If you have any more questions, feel free to reach us. Thank you so much. Have a great weekend. And yes, thank you again for amazing information.
Thank you for having me.
Yes, and to everyone, bye-bye now.